Hi, everybody. My name is Connor Lynch with Westwood Media Center. We are proud to be partnering with the Council on Aging to provide virtual programming through our cable channels and online to keep seniors engaged throughout the coronavirus pandemic. We can be found on Comcast channels 8 and 12, Verizon channels 32 and 42, as well as online at westwoodmediacenter.tv. I'm happy to turn things over to your host, the Director for the Council on Aging, Lena Arena DeRosa. Lena, take it away.
Thanks, Connor. And once again, I say this every time, but thank you, Connor. Thank you, Westwood Media Center. We love our partnership and we wouldn't be able to do this without you. So thank you. So today we are going to be talking about Shine. Lisa Matthews, and I'm going to make sure I say it correctly, is now the director at HESCO for our Shine appointments and for our Shine counselors. Let me give you a little background about Lisa, and welcome, Lisa. We're so glad you're with us.
Thank you. I'm glad to be here.
Lisa Matthews grew up in California, then moved east for college and medical school. While completing her residency in Los Angeles, she married a college classmate from Queens, so they moved back to the East Coast, which we are grateful for. We're glad you're back east. She practiced general OB/GYN in Connecticut for 18 years, then moved to Sharon and practiced for another 10 years in Bridgewater and Foxborough before retirement. Now, not one to slow down, she then attended graduate school when she then studied public health and health policy. Like, amazing, girl. That's what you did in your retirement. Lisa joined HESCO as a volunteer in 2018, and we were blessed because we actually had her here in Westwood. And then started coordinating with HESCO and became their director about 6 months ago. She coordinates the many programs for seniors, including Shine counselors for 32 communities. And now, she coordinates the Shine, she's a Shine counselor for 13 communities. I wrote that wrong. And she now directs the Shine program for 13 area communities. Welcome, Lisa. We're so glad you're with us. And thank you for explaining what Shine is. Take it away.
Thank you for having me. I just want to clarify that HESCO covers 12 communities.
I knew I had that wrong. There you go. Okay.
That's okay. It's really confusing. In fact, many of my own Shine counselors forget about this sometimes. HESCO covers 12 towns, 13 kind of general communities in this area, including Westwood, and that we at HESCO coordinate Meals on Wheels, things like that. But the Shine program also covers 10 other towns. So we have Shine counselors in 22 different towns all over southeastern Massachusetts. We go all the way up to Braintree and all the way down to Scituate. So we're covering a lot of territory in between there too. We go as far north as Randolph. And then after that, the Boston area groups take over. So what does Shine do? Shine is actually a program that was started by Medicare in order to help Medicare users access their Medicare and get more information about how to enroll and how to use their insurance through Medicare as a federal program. Although it is set up and run as a federal program, it is really voluntarily staffed. There are very, very few paid staff people in the Shine program, or the SHIP program as it's called in some states. So it is a federally mandated but unfunded program, and we save consumers lots of money every year. We really do earn our keep as Shine counselor volunteers. So some of the things we do, there's just a lot of different things we do. We sign our elders and not so elders, disabled people too, up for Medicare once they are ready for it, either due to retirement or to disability or to age. We explain how the different parts of Medicare work. We help consumers to shop for their particular needs. We're not selling any particular brand of insurance the way a broker would. So we're volunteering to help people find what works best for them. And we help to also access assistance with Medicare costs for qualified consumers. So sometimes this will be prescription assistance through a state program called Prescription Advantage. We also help consumers apply for Mass Health if it's appropriate, and there are several different programs where Mass Health can help with Medicare costs. We give pointers on dental insurance also, although Medicare itself does not pay for dental insurance and never was intended to. But we have a few leads and can sometimes assist our elders in the community to get help with dental insurance. That is a really big issue. We also help select the proper drug plan, and sometimes just a difference of the provider of your Part D freestanding drug plan, or even changing pharmacies can make a big difference and save a lot of money for our seniors. Now, there's a few things that Shine does not or cannot do, unfortunately. We cannot pick the plan for you. We can help you make a decision, but we cannot just pick a plan and decide what's best for you. Your neighbor might totally love something, but that might not be the right one for you. So we give you the information so you can make your choice. And we respect your choice, and we preserve your confidentiality and privacy when we do that. And these days, with COVID, we want to keep everyone safe. So we preserve your safety too. We do not complete the Mass Health applications, which are a little daunting, but we do give some pointers on how to complete the applications and help with obtaining the forms. We do not meet in person this year, unfortunately, because of COVID and safety considerations, both for our counselors and also for our clients or our consumers. So we provide telephone consultations, and we also work a lot by email or by Zoom even. And we handle, if it's just a matter of selecting Part D forms during open enrollment, which is coming soon, just a couple more weeks, ladies and gentlemen, and open enrollment will begin. And we can do a lot on paper. So there are forms that consumers can fill out and get back to us through the Council on Aging, or they can be scanned in and emailed. There's lots of different ways that you can get that information to us without meeting face to face. So this year, no face-to-face appointments. I hope next year we will be able to do it again in person.
In Westwood, we actually are going to have a Dropbox. We're actually getting a Dropbox so people can drop things off. For our counselor's name is Mitch, and he does everything through the phone. I didn't mean to interrupt you. Go.
No, Lena, I want to hear more about your Dropbox. How does it work? Is it outside the building or in the lobby?
Okay, so what we're doing here in Westwood is we're going to be getting, where it should be in the next week, we're going to get a Dropbox. It is completely secure. You have to have a key to get into it. It's high, so people can't reach into it. And yeah, no, we're doing it. We're being very safety, and people can drop it off there. Give us a call, say that I dropped it off. We'll make sure it gets to our counselor, who is Mitch. And he will then make sure that it stays securely in a locked drawer. So all of your information will be kept secure and confidential. And it's the safest way for us to proceed during the pandemic, because they can't come into our building right now.
Yeah, many councils on aging are using a Dropbox method. And if there is time, you can use US mail and use our HESCO mail, but we would prefer it to go to Mitch and his friends. We're going to have some friends helping Mitch also with all those forms this year.
Okay.
Yeah, and if you're using the mail, remember the mail is going to be the U.S. Postal Service is going to be very, very busy. For that reason, if you decide to mail in forms, we're going to have a cutoff this year. Open enrollment starts October 15th, but you got to get your form in the mail by November 1st. If it's postmarked after November 1st, we can't necessarily get it back to you by mail in time for you to still be during the open enrollment period, which finishes December 7th. So we're enforcing, and we had the same cutoff last year too, November 1st for mail-in drug search applications. And we'll talk a little bit more about that. Lena and I are going to talk more about the drug searches. But after that time, you can still have your get help selecting your drug plan through 1-800-Medicare. But we encourage consumers to use that after that November 1st cutoff to make sure that it gets done in time.
And we're going to have the Dropbox available. So if you didn't mail it, you can put it in our Dropbox. And we have appointments already ready to be scheduled through October, November, and early December. So we've already got a list. If you're interested, call us and we'll put you on our list so you can talk via phone with them and drop off your information via our Dropbox.
Perfect.
Okay, do you want me to start asking questions or are you still talking? Are you still going through?
I'm pretty much done with my part of the presentation. Great. I wanted to allow lots of time for the questions.
Okay, great. So we have some really important questions, Lisa, for you that most people want to know. First of all, what's the difference between Medigap insurance and the Medigap Advantage plan? That seems to be the question that everybody wants to know and understand better.
Yes, there is quite a bit of confusion, and it's not helped because there's a lot of advertising that starts this time of year for Medicare Advantage plans. Medicare Advantage plans, or Part C, is a special kind of plan that some consumers like to use. If you're in Medicare Advantage, your doctor and your consultants and your hospital, all your healthcare providers are within a network, and you're expected to use that network. Some of the plans will let you go out of the network, but then you might get reduced or no coverage at all. So there are some rules about Medicare Advantage that some consumers don't like, but Medicare Advantage includes your drug coverage, your prescription drug coverage. So if your medications are on the formulary or the list of drugs that's covered by your Medicare Advantage plan, and if your primary care and all your consultants are in that plan, it might work well for you. And you can get Medicare Advantage plans as low as $0 on top of the Part B premium that you pay every month. So it can be very cost effective for people who are on a tight budget. Many of our seniors, though, prefer original Medicare. With original Medicare, you have your Part A for hospital, your Part B for your outpatient things like the doctor's office and testing, and Part D for drugs. So you have to get all three kind of coordinated, and there are significant deductibles and co-payments associated with Part A and B, and sometimes with the drugs. And so a Medigap plan will cover those gaps for Part A and Part B. For drug co-pays, usually the consumer has to pay those. And after a substantial amount of money has been paid, then sometimes a consumer will get in a situation we call the donut hole. We'll talk about that later. But you can't really buy insurance to cover those drug co-payments. That is your responsibility. But you can get insurance to cover your co-payments at the office and at the hospital. Those are big co-payments, folks.
Absolutely.
Those are big deductibles.
Absolutely.
Like $1,400 if you go in the hospital. So if people can afford it, many choose to go with original Medicare, and then they have their Medigap plan to cover their gaps. Now, one advantage to that strategy is you can travel. So if you have a lifestyle where you go to Florida half the year, or Arizona, something like that, the Medigap and your A and B and D travel with you, whereas a Medicare Advantage plan won't necessarily cover you if you travel.
That's really important. And again, this is why you need to talk to your Shine counselor, because they will help you figure out what is best for you and your lifestyle.
Exactly.
So another question we frequently get is, I don't take any prescription drugs. Why do I need to pay for a drug plan?
Well, blame Congress. When they passed the part of Medicare in 2006 that brought about the Part D or drug coverage plan, the Congress decided that it was very important for everybody to have drug coverage because we can't predict what's going to happen. Insurance is to cover situations you can't predict ahead of time. So
Absolutely.
even if you're not taking a drug now, you might have a condition that could arise. You could have a blood clot, a stroke, a heart attack, heaven forbid, COVID, and need potentially some very expensive medications down the road. So the Part D is mandatory, or some type of drug coverage is mandatory. If you're in a Medicare Advantage plan, Part C, that also meets that requirement.
Absolutely.
But you can't go there
No.
if you don't have that Part D coverage. If you ever decide to go into it later, there is a penalty applied for the rest
Yeah.
of your life.
Yeah. Okay.
So,
So another question that people always ask is, I'm covered by my spouse's employment health plan. Do I need to sign up for Medicare?
well, the answer is possibly. It depends on your own needs. You can stay on your husband's health plan, and provided that the husband's health plan is considered what they call deemed equivalent to the drug coverage that other Medicare plans offer, you could stay on your husband's plan. Sometimes, though, after age 65, employers begin to raise the premium that is taken out of the employee's paycheck because of age rating. That is, the older you get, the more likely you are to require services, and the premium goes up. I have talked with many, many consumers who found, both employees and their spouses, it was cheaper to go onto original Medicare with a Medigap plan rather than to use the employer's health plan. Some employers give very generous retirement plans where they will pay for the Medigap, something like that. That's a different situation. You still have to sign up for your Medicare then, but the employer, as a perk for retirement, might provide the supplement. And that is a very handy thing to have and does save money. So we see all different kinds of arrangements with that. Government employees who are in the GHI system, they get also very generous benefits, and town employees who might be in their own town, not necessarily Westwood, but others, sometimes get pieces covered. I hope that's not confusing.
That's really helpful. Thank you. So another question we always get, things like, are vaccines like the shingles covered?
This year, many shingles shots will be covered under Part D. That is the drug coverage. Also, shingle shots might be covered under Part B, and then also under the Medigap plan. So you need to check with your particular insurance company to see which way it goes. And that's important because then when you go to get your shingle shot, the person providing the shot needs to know how to do the billing.
Right.
So that you don't receive the bill. Right.
Absolutely.
So you'll need to double check with your insurance carrier, either your standalone Part D carrier or your Part B carrier, to see which way it falls.
Okay, so now that takes us to the story that everybody wants to know about. What is the donut hole? And what does that really mean? Because everybody wants to talk about the donut hole.
Yeah, and there was also, there's a lot of, I don't mean to say fake news, but I'll call it misinformation about, or rumors about the donut hole. There was a lot of talk that in 2020, the donut hole would go away. So
Yeah.
What that referred to was once a consumer has spent a certain amount of money, that both out of pocket and also based on what the pharmacist has spent for the retail cost of their drugs, it's about $4,000, you enter a phase of Medicare payment called the donut hole. In the beginning, in 2006, it really was a donut hole. There was no coverage, zero. And this was a disaster. A lot of Congress people heard from their constituents about this, and then they have gradually modified payments through the donut hole. So the coverage for your drugs may change when you are in the donut hole. Generally, for a brand name drug, for example, it will be about 25% of the drug. Now, this can be substantial. If you're taking Xeljanz, which retails for $4,000 a month, 25% of that is $1,000 a month. So sometimes our consumers call us, they've gone into the donut hole and they're getting huge bills at the pharmacy. We can help sometimes with some programs to assist. Once you leave the donut hole, which is at around $6,000, then the consumer pays 5%, a flat rate. And at that point, that is called catastrophic coverage. And there are programs to assist with that too. So it's very complicated, but it definitely exists. The reason some people were talking about it going away was the lack of coverage went away. There is some coverage now. In fact, 75% coverage for a brand name is pretty good coverage, but it's still. So the donut hole is still with us. And frankly, there is so much going on in Congress right now. I wouldn't look for any huge changes in the next 6 to 12 months. It'll probably be down the road, depending which administration we have.
Yeah.
Comes up all the time because as we know, seniors vote.
You better vote this year. Okay.
Yeah.
We're not going to get political. I'm turning 65 in January. When a consumer has asked us, when should I sign up for Medicare? This is so important.
Yes, this is probably the second most common question we get.
Yep.
And that depends on if you are working or not, and if you are receiving, because you might not be working, but your spouse might be working and receiving benefits through the employer. Once you turn 65, you need to be having coverage of some sort, and that needs to include drug coverage, even if you're not taking any medications. So if, say, you are turning 65, but you're a wife and your husband is on good employer health coverage but meets all the requirements, you can sit back and not fret. At some point, you will need to activate your Part B, which then turns on your Medicare. And crazy enough, to turn on your Part B, you call Social Security. You don't call Medicare.
Right. So say that again.
So to begin Medicare, it's done through Social Security.
And you should call 3 months before you turn 65.
You can do it as early as 3 months before 65, and you don't want to wait until, especially not till after you turn 65.
So we always suggest
3
months before you turn 65, call Social Security.
The time goes so fast, and it takes a while to process the Part B. And then you can shop for your plans in an unhurried environment.
Right.
Once you have turned 65, or worse even later, this is if you're just getting Medicare because you're turning 65 and not switching off an employer or losing your job or something. Then it will delay activating. The Medicare won't start for 1, 2, or even 3 months after you sign up for it. So it gets complicated. Sign up 3 months before. And we're so lucky that we have a really good Social Security office over in Norwood, and there are real live people working there. You can't walk in, but you can call them and they'll give you good advice and they'll help to process these requests. You can also, because of the COVID emergency, Social Security Administration began all kinds of online ways that you can apply.
We did a Social Security program like this, and Delia helped us and explained, but the number one takeaway was, please make sure you sign up 3 months before you turn 65. Okay, so my final question is, what is the best way to proceed? So you're thinking you should go to Shine. What should you do?
Call Lena.
You can call any COA office. You can call us.
You can call any.
But why don't you give your number at HESCO and I'll give my number here.
That's perfect.
Okay.
So our number at HESCO is 781-784-4944 and ask for the Shine office. We have different volunteers working at different extensions every day. So just ask for Shine and the secretary will the receptionist will put you through into the Shine voicemail. We do take our calls right in order, quite scrupulously in the order that they are received. So they come in on the voicemail and then we call you back. When you call us, I don't know how it works at the Westwood COA, but when at the senior center, but when we get calls, sometimes people are so excited and they speak very rapidly and we can't quite catch a number, or numbers get transposed. So be calm, speak slowly, and repeat the phone number. Then we're more likely to get in touch with you. And then also make sure you tell us what a good time is to call you back if it's not throughout the day, because we make most of our calls during the day. So sometimes we can set up a phone appointment, but we need to speak to you live. So,
Absolutely.
yeah.
And here in Westwood, you don't call me personally. You call the center. Our number is 781-329-8799. It'll go up on the screen. I'm sure Karna will put it up on our screen. You can call us, and if we're not here, just again, as Lisa said, very calmly leave your name and your number and say you need a Shine appointment. We will call you back. We're here usually in the office from 8 to 1 every day. At 1 o'clock, unfortunately, we have to get our center sanitized, so we need to leave. But we do check our emails. We check our voicemails all day. We will get back to you. We will send you a list of what you need to get ready for us. And we always encourage you to go on to the Medicare website and start figuring out what you're thinking about before you even talk to Mitch. But again, we'll have a Dropbox here. So if you need to put copies of the medications that you're taking, if you need to leave messages, any of that, we should have the Dropbox here by early October. And also give us a call and we'll set you up. So, we will send you the information that you need to have ready with all the names of your prescription drugs and everything. And you can leave that form after we've sent it to you in the Dropbox or send it back to us. Again, if you want to have an appointment, we highly recommend that you call us soon to make an appointment, because the appointments fill up really fast. Lisa, go ahead.
And Connor, if you can also post Medicare, it's medicare.gov. You don't even need a www, just medicare.gov. And that is the website, and people can get a lot of useful information on that too. So maybe we can post both of those.
That would be great. So again, if you want to start the process, go on medicare.gov. Make sure it's .gov. There are lots of bad websites out there. Medicare.gov, lots of bad websites. And you can start finding out information and figuring out where you want to go. Lisa, thank you so much for participating in this. We really appreciate your time. We appreciate your talents. And we appreciate the fact that you are now the head of Shine and can help us on a daily basis. Thank you.
Well, thank you. It's a pleasure to be able to help my fellow Westwood residents too.
Have a great day. Thank you.
Yeah.
And Westwood Media Center, thank you again for allowing us to put this important information on cable and call. And seniors out there, please remember, wear your masks. Don't forget. Stay safe, social distance, wash your hands, and together we'll make it through this pandemic. Thank you and have a good day.